Yes, good evening, everyone. And today we have with us our presenter, Dr. Tarjani Vyas. She is an MBBS and fellow in diabetics and metabolic disorders, and she has completed her PGDCH as well. And today she is going to give a very interesting presentation regarding how to control cravings, a case study of hypnotherapy in weight management and loss. So over to you, Dr. Tarjani. We are all ready to hear your presentation.
Thank you so much, Ms. Nidhi. I will start by sharing my screen.
Yes, please. Yes.
Are my slides visible?
I cannot see it right now. Can other participants see the slides? Yeah, yeah.
Yeah,
Yes, it's visible now. Yes, you can start now.
Okay, so as you know that I practice as a metabolic physician. So inculcating hypnotherapy in somebody who had been struggling for weight loss for very long helped this particular person very much. And during the 8 months of the person being with me, they took 10 sessions of hypnotherapy and lost 12 kgs of weight. And I have been following up since 2 more months, and the weight has not regained back. So let's dive into the case. So the problem.
If you could be a little more louder, please, so that it helps with the
Now,
recording. Yes, yes, it's
okay.
good now.
So identifying the problem was there in a 59-year-old female since a decade. She had been trying to lose weight since a very long time, but it was a yo-yo effect. Whenever she tried losing weight, the weight used to rebound back and she used to gain more weight than she had actually lost. What were the key issues that were identified when I took her history were her sugar cravings, midnight eating, and stress eating. She had always associated eating as a stress reliever. Multiple attempts were made in losing weight. She had a BMI of 36.3, which is considered really high, and insulin resistance in her metabolic status. What was her motivation to come to me was, of course, long term health should be better and quality of life. She was, after a while, unable to walk properly and was going to have a knee surgery if she was not unable to lose the weight. So, psychological eating, nocturnal cravings, and metabolic resistance were the key issues identified. Hypnotherapy was introduced to her as subconscious reprogramming to control her cravings, of course, which we know that installs conditioning responses to food triggers, reduces compulsive urges, stress regulation. It activates the parasympathetic system, reducing cortisol driven eating. And of course, we have evidence which shows that hypnotherapy is helps in cognitive behavioral therapy in weight loss management. What was the treatment included? When she came to me first, in the first session, I took her history, talked about what are her triggers, what induced stress in her, and why she resorted to eating as a stress reliever. So a rapport was formed, and then she was introduced to neutral trance. For the first 3 sessions, just neutral trance and a mild programming of relaxation was introduced. In the next 4 to 6 sessions, PMR was done with ego strengthening, like I am in control of what I eat. And every time she came, a homework was given and the session was recorded so that she could practice it at home also. And with Steinfeld clenched fist technique, we were able to anchor the conditioning response to craving triggers. Patient clenches the fist to activate programmed control, immediate interrupt for sugar and midnight cravings. So her session by session journey goes like, in the first 2 sessions, assessment was done. Will hypnotherapy help her? Will only medicine help her? Or we need to work on what actually triggers her? So yes, she was educated about psychology, and expectation settings was done. First, neutral trance was introduced so that we know she was able to accept the hypnotherapy or not, which was perfectly fine. Then in the third session, the trance was deepened, and a little bit of programming and imagination was introduced. Self-placed visualization, reinforcing hypnotic responsivity. In the fourth and the fifth session, progressive muscle relaxation, full body relaxation, and diet and exercise goals were given to her. Only movement and calorie deficit are known to 100% lose weight. But when can you introduce calorie deficit? When the person does not resort to eating more than required. In the sixth session, craving triggers were mapped. That yes, whenever she is stressed, if it is in work, if she has a conflict with her husband or she has a conflict with her kids, she always resorted to eating. So sugar and midnight eating cues via trance state were recalled. In the seventh and eighth session, Kleinfist's technique was anchored, where she was programmed that if you fist your left hand, all your negative emotions are clenched, and whenever possible, she was told to reintroduce that in every day in her practice, so that whenever she sees food, she does not immediately try to eat it and does not satisfy her cravings with just food. In the ninth and 10th session, consolidation and future pacing was done. She was given a homework that you have to do it on regular basis. You have to hear the recordings, you have to inculcate in your daily life, and post hypnotic suggestions for long term habit continuity were given. What was targeted? The core interventions were sugar craving control, aversion imaginary for high sugars during trance, positive substitution suggestions like fruit and hydration, ego strengthening like I choose what I eat, clenched fist anchor activated to on urge onset, reinforced via progressive muscle relaxation to reduce dopamine seeking states. And midnight eating was controlled by sleep onset hypnosis script embedded in an audio session. Post hypnotic suggestion: after 8 p.m., I'm satisfied. Trigger identification was boredom, anxiety, and habit looping. Just because she sees the clock, she feels like eating, which was reversed. Fist anchor conditioned to nocturnal cravings pattern, visualization of morning well being as reward was substituted. In how diet and exercises were integrated, dietary changes like portion moderation embedded during the trance, mindful eating visualization, I eat slowly and I enjoy each bite. There are research papers about if you eat slowly and if you enjoy what you eat with every bite, you probably eat lesser in a the longer the time you chew, the longer time you take in eating, you tend to eat a little lesser. As a metabolic physician, it will calories were introduced in her daily diet, and a fixed diet plan very similar to what she was already eating in basis of caloric control was introduced. Exercise motivation like movement reframed as joyful self-care, not punishment. It's not because I have to walk, I look forward to my morning walk was suggested. Achievement anchors set for each exercise milestone, and behavioral reinforcement, habit loop restructured during deep trance states. Relapse prevention scripts embedded in final 3 sessions, that I enjoy what I do, I have to stick to what I do, and I am a happy, peaceful person, even without eating a lot. Patient taught self-hypnosis for patient was taught self-hypnosis for daily maintenance. So here we see the outcome after 8 months of transformation. When she came to me, she was at 81.9 kgs to be precise, and after 8 months, she is at 70.8 kgs. Zero sugar binging after session 7. We saw significant change after session 6. Till then, it was a little difficult. Even retention on hypnotherapy was a little difficult, but after she started seeing the results, it was easier to inculcate the habits. Midnight eating fully resolved by 5 months. Patient initiated 30-minute walk daily. Reported improvement in mood and energy levels because it was specified that movement is important. Strength training and cardio was introduced in her daily plan. She reported that she had been feeling better as well. This is the body composition analysis, which we do almost every time she visits, which shows the bottom of the graph you see. We see that she started with 81.9 kgs. The first line shows that what her body weight is. The second shows how much kgs of fat she has lost. And the third line shows significant reduction in body fat percentage. Why it worked where diet fails? Because diet only approaches caloric balance. Hypnotherapy addressed the psychological drivers of eating like stress, reward seeking, and habit loops that diet cannot reach. The client fixed technique as a craving interrupt. The anchor created a rapid shift from sympathetic like cravings to parasympathetic control dominance. Its physical nature made it immediately actionable in real world trigger situations. What my role as a metabolic physician to ensure that no hormonal or thyroid contributions were missed. Medical supervision were always done. Generally, we see that if the person loses 0.8 kgs to 1.2 kgs a month, that is sustainable weight loss. So significant changes or significant dietary changes or immediate fast measures were not done. Systemic programming was done so that it becomes a long-term solution. This, of course, is a single case study, but now I have seen more than 10 patients who have seen good results with hypnotherapy and weight loss. So to conclude, clinical hypnotherapy is viable, evidence-informed addition to metabolic weight loss management, neutral trance, ego strengthening, progressive muscle relaxation, and client fist technique form a progressive deepening protocol. Craving interruption, not just calorie restriction, is the key to sustainable weight loss. Physician-led integration ensures safety, accountability, and holistic patient care. If we miss some reports or if we miss some pathological factors which had led to weight gain, then we would not have been able to achieve such results. So 12 kgs over the 8 months demonstrates clinically meaningful and sustainable weight loss without surgery or any kind of pharmacotherapy. It was a short presentation and I'm open to discussion in any form. If you have any questions, please let me know.
Thank you for this excellent presentation, Dr. Tarjani. And I'm sure when we upload it on our YouTube channel and other people also hear about this presentation, it is going to be really helpful because lifestyle diseases are becoming almost a norm like in today's day and age. We all
Right.
have somebody in our families or we ourselves who are
Who are
suffering from
struggling with
uh,
weight, yes.
weight issues and diabetic related issues.
But if we do
I'm
not address the key factor, what is causing it, probably we cannot achieve it.
yeah. I have always been curious, like what are the specific suggestions to give to a client or if we want to use it for ourselves? Like I practice ego strengthening for myself, for my
Right.
clients as well. But honestly, are there any specific wordings or suggestions that we would want to use to stop, say, emotional eating or stop the sugar cravings?
Right. So the specific suggestions in this patient, what I used was I am in control of what I eat. I am in control of how much I eat. I do not need sugar to feel better.
Okay, I do not need sugar to feel better. Okay, that makes sense. Thank you so much. Are there questions
And
from other participants? Pratibha ji?
Yeah, I see that you've done fellowship in diabetes and other metabolic disorders, doctor. So, now, so do you use hypnotherapy on a daily basis with all diabetic patients?
I have not been able to convert my clinical patients into hypnotherapy as much as I would want to. But people who have some emotional issues, and when I introduce that I'm trained in clinical hypnotherapy, they are open to following up one session. If they feel better, then it can be inculcated in more. Yes. But people who come for an allopathic solution, not everybody opts hypnotherapy, but people who are aware that they have some reasoning to deep dive into their mental state, they are very much open to it. And in my clinical practice, I have a set questionnaire of 20 questions, which indicate that if you need some mental health assessment, some programming to be done, so it has normal questions like have you been feeling better. It has been in the American journal itself. American ADA guidelines only has this 20 questions which I give to my patients who have been struggling for a very long time, so I can evaluate. If the score is more than 11, then they need some mental programming, so I offer
Okay.
them. And then yes,
No, because why I was asking was, so do you see success of this in diabetic? That's why I was whether you use on daily basis. If so, do you see that hypnotherapy somewhere helps in better diabetic management?
it does. When the factor is stress, it does. Just
Hmm.
I tell all my patients that stress triggers your sugars, but
Hmm.
it is not the cause of your
Some
stress,
of
is
the thing,
the
yeah.
cause of
Okay.
your diabetes.
Hmm.
So if there are stress factors and your sugars are extremely fluctuating, we should always resort to some mental intervention, so that the stress levels go down and
Okay.
proper, yes, and proper sugars can be maintained.
Okay. Thank you so much, doctor.
Dr. Tarjani, where do you practice?
I practice in Ahmedabad in Navrangpura area.
Okay, okay. Do you also take online consultations?
Yes, I do. And my clinic is Wave Diabetes and Wellness. But if the problem is physiological or pathological, Indian Medical Association requires me to see the person once a year physically, and then I can take online sessions.
Okay, okay. Thank you. Hello, Deepal ma'am.
Hi, hello.
You
Hi.
joined us quite late. It was such an interesting presentation.
Yeah, I just saw, just now I saw.
Okay. Tejvi sir, do you have any observations, any questions for
No
Dr.
questions, but I'm
Tarjani?
pretty impressed by the structured methodology to intervene and extend the support to the client. Now since you've asked, a query is there. Where all client had failed earlier in the weight loss journey?
Sorry, can you
Where
come
all
again?
the client had failed in the weight loss journey before coming to hypnotherapy? I'm just curious for that.
So she followed one weight loss program where I do not want to name the company, where they sell Ayurvedic drugs for
Hmm, hmm,
weight loss that she had tried. She had
hmm,
joined a gym which she was unable to continue,
hmm,
and she had visited the another metabolic physician also, which told her to resort to GLP therapy. GLP is
hmm,
incretin therapy, right? Whatever
hmm,
the injectable and oral GLPs are coming up for weight loss. But she did not want to resort to medication soon. So this was introduced, and that was helpful. And generally, who are people who are willing to lose a lot of weight, they would have attempted gym, they would have gone to a dietitian, they would have followed structured diet plans, but that is not sustainable. They will
hmm,
give you a chart, and then whether you can follow it or not, after a while you will resort to Indian population. What I have observed is will
hmm,
resort to roti after a while. You
hmm,
cannot
hmm,
put
hmm,
grains out of their meals,
hmm,
but what
hmm,
you can do is tell them not to overeat more than their body requires.
hmm. Now, with this kind of hypnotherapeutic support to the client, now if they approach gym, are they expected to have still better results?
Yes, definitely. So, like the last slide I showed you,
Hmm,
the
hmm,
body composition analysis, the
hmm,
body fat percentage reduced,
hmm,
but she
hmm,
was not able to gain a lot of muscle.
hmm,
Body
hmm.
fat,
Fat, I
kgs
saw
were
that reading that fat was up. Hmm,
that hit a plateau. So if
hmm,
she is able to strength train and do cardio more, the muscle strengthening will be better, and
hmm.
that will help her even more. Yes.
Good. Thank you. Thank you. A very good presentation.
Thank you, sir.
And I'm in Vadodara only, so there's a lot of references will be there in
Thank you so much.
that.
Yeah, Dr. Tarjani, I want to ask you something. Can I ask you?
Sure, ma'am.
I have not seen your presentation, but I just now I saw the topic and I thought let me join. So I joined because um, today I came back from the hospital with a diagnosis of mild fatty liver symptoms,
Okay.
diabetic stage, first stage, pre-diabetic stage, and I am following everything, means the diet and the cardio and strength exercise and yoga and kapalbhati and walking, eating balanced diet. And even then, when I got this diagnosis, I felt so bad.
It must have hit you like a train that
Yeah.
somebody as living as healthy as possible.
I'm not eating outside. I'm not eating anything which creates any metabolic issue.
M- Ma'am, with what you don't eat, it is also very important what you do eat. If you are eating 5 colors of fruits in a day, are you able to exercise enough? Which includes all the three things. That is your breathing exercise, also, your strength training, also, which is lifting weights and cardio as well. Everything in balanced amount. You do one thing on a very long scale and severely, which you are not able to maintain, will not give you sustainable results.
Mhm.
And even though all the markers may be elevated right now, it is
Mhm.
possible that you might have a family history. And if you do have a family history, we can only prolong you from getting it. You will get it after a while, but we can prolong it as long as possible for however long you can be non diabetic or just remain in the pre diabetic stage.
Mhm.
So, if you have been following a very healthy diet and forcefully programming yourself not to eat
Mhm.
outside and everything, that will also create a lot of stress. But if you go out and have a salad, that's fine. You do not have to force yourself that I do not have to eat,
No,
because
I'm
when
not forcing. I'm not forcing, but I don't feel like eating outside, I'm not forcing myself. But this is the thing, suddenly when this diagnosis came, oh my God. And just uh, day before yesterday night, till 8 o'clock, I was working, I was taking session, online session, I completed at 8 o'clock. And then at 9 o'clock, I had a big vomit. And then diarrhea started. So 9 to 12, I had a diarrhea and vomit. And then I became dehydrated. And then
Mm.
suddenly, then I shifted to the emergency.
Oh.
That was the episode. So
Ma'am, that needs to be evaluated. If you can send me over your reports or your hospital history, anything, I'll be more than happy to help and we can connect one to one.
yeah, definitely. Because when I saw the topic, so suddenly I joined this. So definitely I'll take your help because still I am in puzzle. Honestly, I am in puzzle कि क्या क्या गलत हो गया, क्या गलत
And
हो
it's not every time lifestyle, it can be familial also, familial history, if that is very significant. It can be there also, but science has advanced a lot. Everything and anything is
गया.
possible to keep your all your metabolic components in chart.
Hmm.
So do not need to worry.
Yeah, okay. Thank you, doctor. So I'll definitely take your help at 1-to-1 level. Okay. Yeah.
Sure.
Thank you.
Get well soon, Deepal ji. I'm sure you'll be fine now.
आई विल यार, मैं देखो कितनी बीमार पड़ रही हूँ, मैं अभी ठीक होने वाली हूँ निधि।
Yeah.
अभी मैंने डिसाइड कर लिया है।
Good. We all want to see you healthy and happy. Dr. Tarjani, I have a question. You talked
Yes.
about the genetic part of diabetes and metabolic disorder. So, can you also guide us about for young children whose parents are diabetics and whose grandparents are also diabetics? Like, there is a very strong genetic
Family history.
component of family history.
So there
So,
are two different
what
things.
should
One
they
is,
eat and not eat to prolong the process? Yeah, please.
sorry to interrupt, but there is two different things. One is a genetic component and one is a hereditary component. Hereditary component, yes, lifestyle and food helps. If you have a genetic predisposition of having diabetes, no amount of lifestyle, I'm sorry to say, but no amount of lifestyle or food will help you from not getting diabetes. But if it is just hereditary, it runs in your family, you can, of course, program your meals and your lifestyle to prolong it as long as possible. So, I was a part of this study where we studied that how many patients, three high volume clinics were taken, and how many people under the age of 30 had diabetes in 2012, and how many have diabetes in under the age of 30 in 2022. We found that only one person was there in 2012, and today, like in 2022, there were 44. So now we see it's significantly rising in younger age. Why? Of course, we blame exercise and lifestyle. What probably our previous generation was started doing in their late 20s or even 30s. Children, as far as I know, from 1 or 2 years, they have been following the lifestyle. Who is not eating out? Who is not eating processed food? So it is difficult to program it on a very smaller age. But yes, if you somebody who is planning to have a baby, we guide them and the baby will be beneficial.
So people like me, we have young children, teenagers, right?
Right.
So and they exercise, and today's teenagers are like into sports and everything. Any specific
Correct.
guidelines so that they can at least prolong the process of diabetes or be in safe zone for a longer period of time?
Yes. So the RSSDI is a research in Society of India. RSSDI has come up with guidelines for specifically for teenagers whose parents have a history of diabetes and they are prone to having diabetes. If you want me, I'll send it along to you, or you can Google it also. There are specific guidelines and what to do, what. And in simple words, if I can tell you 3 things: avoid direct sugars, exercise for 30 minutes 5 days a week, and try to maintain your stress levels as little as possible. If the child is a little hyperactive in their teenage, then also, they are more prone to addictions. So addictions can be of sugar as well and of illegal substances also, but even sugars. So if these 3 things can be inculcated, that will also help.
That was really helpful. Thank you so much. Thank you so much. So, do we have other questions or can we call off today's session? I'll just stop recording. Thank you so much, Dr. Tarjani. If people have other questions, I'll stop recording and then we can continue the discussion. Otherwise,
Sure.
thank you so much for today's presentation, Dr. Tarjani. I'm sure.
Thank you so much. Lastly, lately I joined, but I got to know a few things. So definitely, Dr. Tarjani, I would love